Ladies and gentlemen, are you sitting comfortably? Have you had a good day? Oh, come on, you can do better than that. We're trending. We've been trending on Twitter for 5 hours. So you can do better on have you had a good day? Fantastic. Right. So this last session is going to be short, sweet, and powerful. We're going to talk about next steps. I want to hear some of the best things that you've seen today, but I want to start off by calling for Tim Joss of ESOP to talk about the 2 tools, I can't say that after the end of this day, 2 tools that ESOP has developed.
Thank you very much. Thank you very much. This is very brief. There are 2 things that we've managed to develop. The first one was this evaluation tool commissioned by Public Health England. So you've heard about health economics, you've heard about process, you've heard about health outcomes. We can talk about artistic outcomes. All of these things are in this evaluation framework. In here, it's got the URL, so you can link to that and download it from the government website. And there is a big thank you, and that is to Professor Norma Dakin, who wrote it. So bravo to Norma, thank you so much. And I think the style of it's lovely and clear. The original version was a rather complicated research paper, but I think this is something which is a good read and I hope will be helpful to you. The other thing which we hope will be helpful to you is ESOP Marketplace. This is the online dating site. This is the way in which those of you in health who want to keep in touch with any of the 24 programs you've seen today, this is your means to do it. There are contact forms so you can get in touch direct with each of the 24, and we're going to keep that as a lively, ongoing conversation between the health and arts worlds. And the thank you there is to Arts Council England, who funded it, and we also had a very welcome contribution from Guys and St Thomas's charity. So please use it. If you don't use it, it'll stop. Thank you.
So, first of all, who are the chairs of the showcases? I've got Catherine Haddock, Manuel Ramos, Gregor Henderson, and Elaine Rashbrook. Are they here? Any of those here? All gone home. Okay. Oh, yes, we have some here. So I just want to get from them. These are all people from Public Health England, and I want to hear from them what they've thought about their sessions so far. So I'm guessing that you're not Gregor or Manuel, which must mean that you're either Catherine or Elaine.
Yeah, hi. Yes, I'm Elaine. I was chairing the sessions on older people, older people's interventions. I had some really interesting examples of the work that was going on. I think the one thing that came through is that some are well evaluated, some are in the process, and some need a bit more. So that seems to be the critical factor for a lot of the work, but all really inspirational at an individual level.
So the key thing, evaluation. And I'm sorry to have grabbed you while you had a toffee in your mouth. Right. So anyone else of the public health people? Hello. So you must be Catherine.
Thank you. Yes, I'm from the Children and People's Family team here at Public Health England, and we had a fantastic afternoon, really interesting speakers. It was just really, really great to see the evidence. There's lots of data showing what was working on the ground and really making a difference for lots of young people's lives, in particular in areas of disadvantage. So thank you to all our speakers. We really enjoyed it.
So for Public Health England, how important is that evidence base?
It's absolutely critical. So I'm working the Best Start in Life programme, and everything we're doing is based on the evidence. So yeah, it was really good to see that.
Okay.
Thank you.
Manuel or Gregor, are they here? Okay, so just some thoughts from you about what the next steps should be. You've heard from Tim about the online dating site, which will help put people in touch. Anything that you feel should be amongst the next steps that we take in this arts and health world? So here we have, and this is Alice.
Yeah, it's Alice. I'm from social finance, and in every sector I work in, there's peer-to-peer support is constantly helpful. So the extent to which these organisations that have come here today are enabled to be in touch with each other about how they're talking to their commissioners and how they're building their evidence bases, then that support I think could be incredibly powerful going forwards.
So might that be something to include on the ESOP marketplace,
Yeah,
for
exactly,
instance?
or a similar kind of platform.
Okay, very good. Anybody other thoughts? Sir, down here, tell me who you are.
Morris Smith, GP from Liverpool Clinical Commissioning Group. One of the things that occurs to me is that the arts might look into the CCGs and try and find out what their individual priority areas might be and see if they can offer something in response to that, rather than simply hoping that something will be developed and taken up just because. I think we need to key into the reason that it might be taken up. So, for example, in Liverpool, we're trying to get people more physically active, huge priority area. That set up a conversation with Tim, and I think that might then turn into something that becomes real for us.
So so it's about health needs, so being the health pull. And actually we saw that, didn't we, in Breathe Magic? Because in Breathe Magic, somebody had said, oh my goodness me, what can we do for these children with hemiplegia that aren't doing the physiotherapy? And their response was, call in the Magic Circle. So who is this?
Hi, I'm Sydney Thornberry from the Conservatoire in Blackheath. In one of these sessions that we had, which was fantastic, we talked about the need for a network for peer-to-peer support for people to be able to connect and share. And I would like to say that the arts sector already has this with a fantastic network called the Future Arts Centres that was set up by the Albany and involves a number of art centres across the country. We could model that, use that model to set up a similar thing here, which would also work with ASOP to ensure that this kind of annual conference happened also as a sharing centre for all of us. So if you're interested in that, I've got some names on a piece of paper and I'll send out emails and send it to you and you can coordinate it.
Fantastic. So here we have, this is Sue Atkinson. Tell us where you're from, Sue.
I'm Sue Atkinson. I'm from a public health background. Today's been fantastic. I've learned a huge amount. We've seen really good projects, but they have mainly been projects or pilots or something like that. And I recognise, because I've worked in health, that obviously one source of funding is through the CCGs, but all the issues we've raised about evaluation and the problems of getting that established. And I just wonder whether there is something that could be put together for people that might be helpful in looking at where could a funding base come from in the first instances. So the various sources of funding, the possibilities that are around, the range of opportunities that are there. And it came up in a number of the sessions I was at that people asked about where did people get funding from. And I'm just wondering whether it's possible for ESOP or others together perhaps to put together something around available funding sources and how that's come about for some of the excellent projects that we've seen today.
And another thing, of course, is how to take, there's different types of funding out there for pilot work, for evaluation, and of course then for the taking it to scale. And you could perhaps work like some of the things that, the technologies that come out of the NHS, where they have a special program within the R&D bit of the Department of Health, which is NIHR, called Eye for Eye, where they get them to a certain stage, so that's health service funding, but then they present them to venture capitalists and leverage that money that way. And actually it seems to me that that might work for you too, that you could have initial money just to get your evaluation done and then invite in the venture philanthropists to take you up to scale. Tell us who you are.
I'm Ruth Thimbleby. I'm the arts coordinator for one of the health boards in South Wales. One thing about networks is that there already are networks. There's the National Alliance for Arts in Health in England, and we have a network in Wales, and there's another one in Scotland. Today's been very England-centric, and maybe that's something we could do, is to learn from other people in different parts of the country. In my health board, it is becoming mainstream, and it's attracting mainstream funding, health funding. So it's quite exciting what's happening and what's developing where I am.
And I think what's become clear is actually the funding sources are quite diverse here. I mean, we're talking about local health authorities and county councils. We're talking about, it's not always the most obvious suspects in terms of the health service. Sir, who are you?
John Capp, if I could put in a plug for the Better Care Fund, the government has thrown money at vulnerable people, 3.8 billion this year, 3.8 billion next year. I think some of that should be going into what we've seen in this wonderful day today.
Okay, some questions back there. Tim, do you want to come back on any of these things? Okay. Hear from other people. There we are. Let's tell me who you are.
Hello, I'm the director of the Bethlem Gallery. My name is Beth Elliott. We've heard quite a lot of emphasis today on evidence bases, and I'd be interested to have a lot of support for arts-based evidence to balance the medical-based evidence. But I'd also like to make a call for good critical forums, because a lot of this evidence is coming out, but we don't have the sort of support and the critical forums to really evaluate that evidence and the quality of the evidence.
I'm going to come to you, Michael Dixon, on this thing about arts-based evidence and evidence. You've got some thoughts, I know, about this.
Well, I fear the health service has used evidence in the past in order to keep people out, and that's probably something that you've all experienced, slightly hypocritically, because there's quite a lot we do in the health service that doesn't have an evidence base. But what I'm sure is that anything you can do to show that you're cost effective, especially in comparison to what we're doing already, will be really important to the commissioners. But there are other forms of commissioning on the way which are slightly less rigid and slightly more in contact with local people and clinicians. And one thing I want to mention was social prescribing, which you're going to hear a lot about in the next year or so, which will be based upon GP practices, with GPs able to prescribe for patients for whom a tablet or a referral is not the right thing, an activity. And there'll be someone who will be an in-between person that will refer patients to those activities, which might be some of the fantastic things that some of you are doing. And I think this will become a sort of anarchic form of commissioning, because what it will mean is that the people themselves and the social prescribers will begin to mould what patients will be able to access and almost, if you like, secondarily commission the services themselves. So I suppose my advice here is about looking at all these things, and also personal budgets, which were mentioned also this morning, and keep relationships, because one thing about today has been about relationships. It's about the arts and it's about health coming together. And once you've got a relationship, you can get through an awful lot of these things, but make sure that you do know your local GPs, you know your commissioners, and if you can have a really good cost-effective case as well, then you're home and dry.
But there is a basic level of effectiveness, a basic threshold that you have to get over. So, you know, you can't go there with just any old thing. You have to have something that, okay, we don't have a randomized controlled trial or any of those kind of things, but actually there is a basic level that we have.
Yes, there is, and if you can show that what you're doing is actually more cost effective than what we're doing already. I mean, we saw this morning in that first demonstration a lady who'd been going in and out of hospital who had been saved by the reading. If you can show examples like that, and if you looked at the actual financial implications of what she was saying, it was absolutely massive, quite apart from her having a more fulfilling life as a result of it.
Okay, thank you very much. So back there, tell me who you are, jump up.
I'm Jan Burkhardt. I'm a Public Health Commissioner in Children and Young People. I've been commissioning the DAZZLE programme for 8 or 9 years.
Just tell us what that is.
It's the dance programme in Leeds around reducing inequalities through dance. And my thoughts from today was that it's really exciting to see this relationship between dance and health developing. And it would be wonderful if the health representatives here today feel they can be sort of champions for arts and health and share with your wider partners the sort of inspirational side of what can be done through the arts. And the second thing is I do think we should be ambitious. We can be more cost effective than the current provision in so many cases. It's not about being the same or less. It's about being more cost effective. The lack of imagination in public health sometimes, doing leaflets and posters to communities that are illiterate or don't pick things up by reading. You know, the arts has so much to offer, so much imagination in social marketing that we could just harness. So those would be my two thoughts. Let's have some arts and health champions, and let's, you know, continue to be as imaginative as possible.
Very good. And we do need those, we really need those champions. And it goes back to perhaps what Tim was asking the Secretary of State to do, to give permission. That's really important. Over here, tell me who you are. And actually, can I introduce, I don't know whether people met him before, but just stand up, Dave McDade. So Dave McDade is that rare thing. He's a health economist who's been looking at the cost effectiveness of arts interventions. We think you're fab, Dave. Carry on. Okay, so...
my name's Lorato Dunn. I'm an Arts Development Officer for Bristol City Council. I just wanted to pick up on 2 points from the Commissioner and from what Jan was saying around, I think lots of arts organisations do want to respond to the Commissioner's needs and priorities, but how do we get those conversations open, those doors open? How can you communicate to us what those priorities are, particularly if they are local to each area when we're talking about scaling up? So I'm doing a lot of work in Bristol to look at the priorities there, but if I want to work across, then how do we connect those things up, which I think leads back to Jan's point about the health sector advocating for us as well in order to do that.
So anybody from health wants to tell us how we could do that? Anybody from health? Elizabeth Buggins there. Just jump up there. I'm going to try and throw this mic at you. Or it's coming from behind. Sorry, Elizabeth is... I think she's... I'm right in saying that you're chair of the Birmingham Women's...
I'm chair of the Birmingham Women's Hospital, but I'm also chair of the Academic Health Science Network for the East of England.
And just explain what an Academic Health Science Network is.
That exists to try and improve health and wealth through using interventions that are proven and getting them going at scale across the whole of the NHS within our region, which is the East of England. And I think if you have an arts intervention which you can prove works, if you go and talk to your local academic health science network, you'll find them on the websites. They may have a project sort of pocket within which they can promote what you're doing across their network. And that's trying to make the health service better, more efficient, more effective.
And how do we know what the kind of priorities are in each of the CCGs? You're very experienced. Elizabeth used to run a strategic health authority, so you know the weirding ways of the NHS.
Well, they will all have a strategic document which you could find on their website, which will tell you what their priorities are for each year, and they'll just be at the moment developing the priorities for next year and for their sort of next 5 years. So it's worth just looking on the website for the one that's near you and seeing whether any of their priorities match what you want to do.
Now, I cut a lady off at the back. Let's go to you. And tell us who you are.
Thank you. I'm Jessica Harris from the Cultural Commissioning Programme. We're an Arts Council funded programme to try to strengthen relationships between health, local authority commissioners and the arts and cultural sector. Just an immediate response to the question about how do you find out about your CCG priorities. We've got it posted on our website. You can go to a fantastic LGA website. It takes you to your local authority. You can see the Health and Wellbeing Board priorities. Really, really easy to do. I think for me, there is a real sea of change going on, a real wind of change. There's fantastic activity driven by clinicians, but probably mainly driven by the cultural sector and by the arts sector. Some fantastic work going on. The issue of scalability is key, and also how we position it centrally within clinical budgets. A lot of that work is being funded piecemeal by small charities, and we've seen that it supports prevention, it supports recovery. So I think how we shift is a really meaningful question. We're doing some work and we will disseminate the process through which organisations are going about it to strengthen relationships. Kent spoke earlier, thank you Emma for speaking earlier today, about the support that we've been putting in Kent to support their relationships. Gloucestershire CCG is here today, who's working very closely with a network of arts organisations, and we're supporting another 5 localities around the country, and we'll draw out the learning from that so that you can see the kind of processes. And we're also modelling some of the structures within the arts sector that are making commissioning more possible, so that you can have that discussion about how to engage and what kind of models are helping that. So I think scalability is key, and I'd like to think that money can follow scalability.
Okay, any more thoughts? This lady here. And tell us who you are.
Janet Maxwell, Director of Public Health in Portsmouth. I agree there is a real sea change going on, and the other discussions are between what's happening in the councils, or the fact that councils actually have a responsibility for health now with the public health sitting there, is that we now have an opportunity to be sitting alongside our cultural colleagues in the arts and culture departments in the council, and we have a foot in with the CCGs. So we've got an opportunity to link across the whole health and social agenda, say not social, just social care, but actually looking at things from a community, bottom-up, developing our assets and resources in communities and linking that to the health agenda. So I think there's a real positivity here of actually opportunities to get that debate going.
So actually you might be, or people like you, might be a very good first stop, because you'll be absolutely plugged into this world and able to tell health people not only what the current priorities are, but what you're prioritising too.
Yeah, we have a really good link right across the board on that. Yeah.
And what are people like you called?
Directors of Public Health.
Directors of Public Health, but within
the local authority.
Within the local authority, right. She's a perfect person.
Hi, I'm Jeanette Cowley with Big Blue Drum. Sorry, you want me to stand up. I'm actually from my own background is actually from the private sector. And one of the things that struck me, I was just in a presentation where one of the junior doctors said that the arts education that she'd been given whilst studying had helped her. And she'd realised that when she was working with her patients, she realised fundamentally she is made of the same stuff as her patients. And it made me think that business leaders are made of the same stuff as everybody else. And I wondered, it just sparked a thought, whether you could get some champions who are leaders of some of the FTSE 100 to actually work with the health organisations so that you get a little bit more PR. Because I spent my career bringing arts into business to show that people could get better productivity if their people were healthier, mentally and physically. And it's just an idea that there might be some collaboration. And I've really, really enjoyed the day. I've only been here for half of the day, but it was fantastic.
Okay, so what we're going to do now is we're going to hear from our choir, but just I host an enormous amount of conferences and events within the health world, and I can always feel when a condition or a particular issue is about to just hit the big time. You are about to hit the big time. This is your moment. Do not waste it. So go away from this conference and collaborate together, because actually now is the time for you. This is your moment to shine.